Hi everyone, my name's Dr. Amira Sankey. I am a plastic surgeon in Sydney South and I work at Southern Aesthetic Plastic Surgery. I'm so sorry to be running late. Of course a plastic surgeon would be running late, but I'm not as good at technology as I am at surgery. So Trish had to very kindly just talk me through how to get on here. Hello, I can see we've already got some people joining, which is lovely. So please write through your questions. I would love to answer them. A bit about myself. So I have a bit of a focus on massive weight loss. Today I did some consulting and I saw 3 new patients who were coming for body contouring about their massive weight loss. And between those 3 people, they had actually lost a total of 150 kilograms, which is just astonishing. So I would love to answer your questions tonight about things that you're thinking about having done, or any questions about your post-operative management, or things that are stopping you from going ahead. So any fears or concerns that you wanted to suss out with me, that hopefully I can make you feel a bit better about plastic surgery and what might actually suit you. So how about I might get the ball rolling by answering some common questions that people ask me. One of the most common questions I get asked is, do I do more than one skin removal procedure at a time? So often after massive weight loss or after childbirth, you need multiple operations, and people are really worried about their downtime and minimizing that downtime and having more than one operation. So the simple answer to that question is yes, if it's safe, I will do more than one operation at one time. And I tend to limit things to 6-hour stints, for the reason that after that, you sort of start to increase your risk of blood loss, blood clots in the legs, getting cold in our cold operating theatre. And so we want to minimise those risks, because most plastic surgery is elective surgery. There's no need to take on any life-threatening risks with that procedure. Thanks, Jules. The most common thing that we would tie in together would be breast surgery put on together with a tummy tuck. Because they tend to be the 2 things in the mummy makeover, or the 2 areas that most people complain about after having kids or after their massive weight loss. So for example, it would take 6 hours to do a breast lift with implants as well as a tummy tuck. If we were going to do 2 procedures together, what other things would we tie in together? Things that work sensibly anatomically. So, for example, breast and tummy tie in well because they're in the same part of your body. Doing brachioplasty and breast surgery would also tie in really well because they're both in the upper part of your body. And then guys, do your thighs by themselves because it's very painful to tie that in with any other procedure. And again, doing 2 thighs is almost like having 2 tummy tucks. So Christina has asked, how can we show a photo to get an opinion on what needs to be done? And Trisha's kindly answered, try and add a photo here. Oh my goodness, talk about that. Live consulting and live photo analysis, that's putting the pressure on, but I'd love to see one. So Michelle is waiting to have her thighs done very soon. So let me go through some of the questions that she asked me about her thigh surgery. How long is the recovery from a thigh lift, and how can you prepare yourself for the procedure? And I think the best way to prepare yourself for your thighs is to leave it until last. Do other procedures first. Very few people need a thigh lift if they haven't had a massive weight loss. And that usually means that we have an opportunity to sort of try how you are with body contouring surgery and how you recover by, say, doing your tummy or your breasts or your arms first. And that gives you confidence because you know that you're doing the easier procedures first and you know what to expect from those operations. So if you normally recover really well and you do well with the limitations in movement and you've got lots of support from your family and it all seems to go really easily, then you're probably going to do really well from your thigh lift surgery as well. And then you go into that with lots of confidence. How else can you prepare yourself? I think it's a good idea to have home set up for not having to walk and move around too much to rest your thighs, and then also to get the support of your family. Simple practical things like having lots of food in the freezer, getting maybe HelloFresh so that you're not having to run out to the grocery and someone else can then cook for you. So I've got a question. I need a body lift, but I wanted a fleur-de-lis to bring in the sides. Is this so? Here we go. Is this something that you would consider doing, or is it even possible? Yes, definitely. So just to explain to some of you that may not know what a fleur-de-lis is. So a fleur-de-lis operation is what removes skin in both the vertical plane, so that lower tummy skin. Come on guys, I'm going to show you my tummy. So the lower tummy skin at the bottom, but what it also does is it brings in your waistline a little bit more. So it brings you in that way. Okay, so it's removing the skin in 2 dimensions. When we do a total body lift, that means we're removing the skin 360 all the way around at the front and the back. So even though it's quite a long operation, I can do that all together. And people who are best for that are people who are feeling very, very saggy in the buttock area, at the lateral hip area, and may have like an additional tummy roll at the top that we also want to bring in. So yeah, we can definitely do those 2 together. Next question is, I've lost about 17 kilos. Well done, I'm trying to lose 3. And always had a lower belly muffin top. I'm 26 years old and always been very fit, healthy and active. I'm not sure if a tummy tuck or just skin removal is required. Yeah, look, that is tricky. I'm not too sure what you mean between tummy tuck or skin removal. So I assume maybe you mean muscle repair and skin removal. But in a tummy tuck, what that does is that we use, in a classic abdominoplasty, an incision that runs from hip bone to hip bone, so very low down, and that incision allows us to remove the lower skin excess, and then we tunnel up to the rib cage to then expose the underlying muscles that have usually been stretched as well. We repair them. In a young woman that may not need repair because she hasn't had children, and then we bend the bed into the V shape and stretch that skin back down. So it's very, very, very powerful operation in removing the lower tummy skin excess. It may not be very effective in removing excess skin in the upper part of your tummy, and that's when sometimes liposuction or additional tummy tuck procedures can help. So next question. Hi Amira, I've lost over 50 kilograms but am still 110. I've been maintaining that for 6 to 8 months. I'm pear-shaped but my arms are so bad. Is it recommended to get arms done when I'm still that weight? So that's a tricky one, and it depends on your height and your BMI and just the look of you in a way, Tracy, because for example, I've got a patient that I did just recently who is exactly your statistics. She lost 50 kilograms after a bypass, and she's 100 kilograms, and I've just done a tummy tuck on her. But to be honest, in most patients, I would recommend trying to get down a little lower than that, and perhaps being in the 80 to 90 kilo range at least. The reason is that if you do have the capacity to lose further weight, it would be a great shame to have such significant surgery and go through that and then find that you do lose more weight and you need to have yet another operation. So I think it's a really good idea to hang in there and try your best, and maybe you are just going through those cycles of fluctuations and that you do have a little bit more weight to lose. Having said all that, if you really are at rock bottom and your arms are really, really bothering you, it would be a pleasure to see you and to give you an honest opinion as to whether we could either two-stage your arms and do liposuction in one setting and then excise the loose skin, or if you may even be amenable to one operation where we would liposuction remove the skin all in one go. Best of luck. You can do it. Okay, next question. Extended tummy tuck and arms together, good idea or not? Well, you know what I'm going to say, it's a great idea. It's the main reason why I don't usually encourage tummy tuck surgery and arm surgery at the same time is that in a tummy tuck, your core is sore. And then you need your arms and your legs to mobilize you and move you around and get you going. So I figure if both your tummy and your arms are sore, you've really got not very much to rely upon, just your legs to get you out of bed and get you going in the morning. But there are certain patients who have incredible motivation and who also don't have a lot of skin to remove. So if I don't think either operation is going to be particularly big, so your arms and your tummy are not that bad, and you're really pressured for time, then it may be possible. Next question from Michelle. Trish mentioned you do a reverse abdominoplasty for people with lots of extra skin under the boobs. And what is called a corsetry for the right person? Can you explain it a bit? Yeah, sure. So there are lots of different types of tummy tucks. The classic tummy tuck is the one where we just remove loose skin from the lower tummy. The way I kind of recommend my tummy tucks is to look at where that person is carrying most of their loose skin. So if they have an upper tummy roll, then what I do is I would bring that upper tummy roll under the bra line here and tuck that in. So we're removing that upper tummy roll and taking it up into a scar that sits in your lower bra line. If someone has that upper roll, but they've also got a lot of back loose skin, so back loose skin that seems to be carrying forward into the tummy, that's when I would recommend a corset tummy tuck. And the corset tummy tuck has a scar like a reverse tummy tuck under the bra, runs down the midline and down below as well, like in a classic tummy tuck. So I guess in a way, a corset tummy tuck is a reverse tummy tuck together with a fleur-de-lis. You cannot get any tighter than a corset tummy tuck. I think the next step would be to just disappear. So it's also an extremely powerful operation, but I would only entertain doing it in people with a lot of loose skin. So, next question from Jill. Hi Amira. Hi Jill. When would you recommend just liposuction? Well, I had a burger tonight, so I think I would recommend liposuction to me before bedtime. But liposuction for any part of the body is a good idea when you have great quality skin that's going to bounce back really quickly, in addition to a localized area of fat that is being stubborn and is not going away just with weight loss. I would not recommend liposuction as a form of losing weight, like I just suggested after my burger. And I would not recommend liposuction for people who have loose skin, because basically the only thing that tightens skin is to unfortunately remove it. Having said that, there is a lot of interest in vasoliposuction. So vasoliposuction is when we initially use an ultrasound probe to release to cause gas bubbles in the infiltration fluid to expand and compress, and then that causes the fat to loosen up. It generates heat, and so vasoliposuction is thought to slightly tighten the skin by heating the skin a little bit. So the analogy I draw with vasa is when you throw a steak onto the grill, it contracts. So the vasoliposuction, in generating that little bit of heat, also causes your dermis, or the collagen in your skin, to contract. Next is Beck. How much, roughly cost-wise, for a tummy tuck? And what kind of info should I give my GP in regards of getting a referral? Was thinking of getting breast lift and tummy tuck at the same time. Okay, so Cost is always really hard, and I guess a lot of you guys must get really frustrated when you ring doctors' rooms, especially mine, and we don't give cost and prices over the phone. And the reason why that is that it is actually hugely variable. So every single patient that comes into my office actually gets 3 quotes, myself, the anaesthetist, and the hospital, and we tailor it to each patient. The reason is that there's varying difficulty amongst patients for the same operation. So I can do a tummy tuck in someone that will take me an hour and a half, and the next tummy tuck I do takes me 6 hours. So that's why there's so much variability, and also whether you're insured or not, and whether you have an item number or not. But to give you a rough estimate, someone who's insured and therefore has had a massive weight loss and has an item number, your out of pocket will probably be between $5,000 to $8,000 for a classic abdominoplasty. So why do you need to get a GP referral? Your GP becomes my best friend when it comes to managing your care, because they give me insight into your health. I've met you for the first time today, whereas they've known you usually for many years, and they can tell me about your history and any investigations and all your other specialist names. You actually must have a GP referral in order to use item numbers. So I am not allowed to touch you, to do anything to you with an item number without a GP referral. So whenever you see my paperwork or your bills or receipts, it will have your GP's name on it too. So that's why we're really fanatical about asking patients for referral letters from both the health point of view to incorporate them and help get their help in your care, but also so that we can properly use Medicare. And in terms of getting a breast lift and a tummy tuck at the same time, that is from the Medicare point of view a really tricky one. So at the moment, and this is very likely going to change soon, but at the moment, a breast lift is only covered by item number 45558 if you've had a child in the past 7 years, and if your nipples are sitting below your breast fold. So the boobs are quite saggy, you definitely need the operation, and we have an item number. And in order to check that we qualify for the item number, excuse me, we usually have to send your photos to Medicare, which is a little bit confronting, but we try to send them registered post so that we know that they're receiving it. If you don't qualify for the breast lift item number and you combine the breast lift, which is a cosmetic procedure, with the tummy tuck, which potentially has an item number, it's really up to the hospital and your insurance company if they even cover the tummy tuck. So they're the tricky and complicated financial times we live in. The good news is, guys, and I think we should look at the cup half full, is that we're still not as bad as the US, that a lot of our procedures are still covered. All right, so thanks guys, letting me catch my breath. I'm going to talk about compression garments because I think this is something you guys talk a lot about. Everyone's obsessed with compression garments. How long should I wear it for? What's it even doing? So the point of compression garments is to reduce swelling and close the dead space. So when a surgeon talks about dead space, it means an empty cavity in the body that's been created by the surgery that potentially fills up with fluid. And we don't want that. We want you to have as slim and as neat a contour as possible. So we want the skin to stick back down to whatever location we've applied it to. So garments help that, and in particular, tummy tuck garment, for example, is going to get the skin to sit back down to the underlying muscle. Why do we want the garments to reduce the swelling? Well, the body, whenever it's healing, sends fluid into an area to take in white blood cells and all the healing chemicals that get your skin and your scar to become beautiful and well healed. The problem is it can be a little bit too good, and there can be a little bit too much fluid and too much swelling, and if you swell too much, then it causes pain because it means there's more tension on your wounds. So the compression is helping to get rid of that pain by getting rid of the fluid. So how long should you wear them for? I would usually suggest for most of my patients in most of their operations to wear their compression garments for about 3 weeks. After that, a lot of people wean themselves out of it by going into a lighter form of compression. So one of my wonderful patients, I hope she's on, she'll know if she's out there, has suggested that Kmart has a really good range, and it's not too expensive. A compression singlet for tummy tucks, or bike pants if you've had a thigh lift, are all really, really good and ideal things to slip into when you don't want the high-end stage 1 compression, but you're still not comfortable enough to go without. So we've got another question. Which do you think is the best health fund? I'm just going to do a quick internet search for you. It changes day by day. And for example, last week we had a lot of trouble with one health fund, which has notoriously been a great health fund. And I think these guys just change the rules on a day-to-day basis. So I can't recommend one over the other. And that's an honest answer. It's not that I've got any financial interest in them. Which one am I with? We are with a health fund called Doctors Health Fund, which I think basically just covers medical people, and so that's why I'm with it. I think they're all a bit crap, to be honest. But as I said, we're still really lucky here in Australia because they're not as bad. We don't have the managed care that the United States has. Okie dokie. Next question. How do I minimize the appearance of scarring? So the best way to minimize your scarring is to see a plastic surgeon. And yes, plastic surgeons do actually stitch wounds differently. And it's partly experience because we have stitched so much more skin. My poor registrars and trainees must have put 1,000,000 stitches with me, watching them carefully and making them remove one for every 2 that they put in. The way plastic surgeons stitch wounds is that we actually stitch most of our wounds in 3 layers. So the deeper layer is to bring together the lining of the skin called the fascia. The next layer is to stitch the dermis, which is the deeper layer of skin. And finally, the top layer is to perfectly oppose or bring together the very, very top part of the skin. So we're talking about something that, you know, a depth that is only that big, about 1 inch, but it gets 3 layers of stitches. And the reason why we put in so many layers is that we have this theory that if skin has less tension on it by being fully supported, then it is less likely to stretch apart and make an ugly wound. So yes, I would always recommend to have a plastic surgeon stitch any important wound in your face, or of course do your plastic surgery. The next step is obviously good post-operative care, and with that you want to avoid infection and you want to avoid the wound falling apart. So the 2 most common causes for a hypertrophic scar, and guys, hypertrophic scar is what most people think a keloid is, so it's a thickened scar. So the most common cause for a hypertrophic scar is a wound that has either come apart or been infected post-operatively. Trisha's just asked me, do I use staples when doing your surgery? I only use staples to tailor tack. So what that means is that plastic surgeons like to try before they buy. So before I ever remove skin, before I definitively cut it off and remove it, I bring it together with staples while it's still not cut and temporarily close the wound that hasn't even been created yet to make sure that I can safely remove that skin. So I only use staples for a tool. They never get left in a patient's body. The only location where I use staples in a patient and leave them there for actual wound closure is the scalp in a face and neck lift. And the reason is that staples are less damaging than a stitch to hair follicles. That's it. I will never, ever use staples on the arms or breasts or tummy or thigh of a patient. Natalie has asked me, do you tape the wounds after surgery? Yes. So we use micropore paper tape as scar management. And micropore tape is a fascinating thing. It's cheap as chips. Don't think I'm generous if I'm giving you a roll that only costs $3.50. So micropore paper tape has a fantastic study that's been done into it. So there was a cesarean section study where they covered half of the wound with micropore and the other half they left that bare for 3 months. And the bit that was under the micropore looked better at the 3-month mark. So it's cheap and it works. But its one nuisance is that you've got to have this tape sticking on you. So I tend to just use it in the post-op period, for usually the first 2 weeks after surgery, and then I change over to using silicone scar gel, which is a little bit easier to use because you just wipe it on the wound and it usually dries. Hopefully doesn't leave a stain on your clothing, and you go about your day normally. So Jody has asked, if you have a breast reduction and lift but decide afterwards you've gone too small, can you get implants afterwards? Good question, Jody. So the best answer for that is don't let yourself get too small, and make sure you clearly discuss with your surgeon what you should expect from your breast reduction or your lift. So the way to work that out is if you currently like the size that you are in a bra, then you just need a lift. If you like the size but you think a lot of it is loose skin, then you may lose half a cup size. And if you currently think you're too big in your bra, look at your friends and go to the bra shop and look at all the different cup sizes, multiple different brands, and work out what cup size you would like to be. And then hopefully with that frank discussion with your surgeon, you won't end up going too small. If you do end up going too small, or you don't get a result that you like you don't have enough upper pole fullness because your tissues just, they're just not good enough to get you that fullness and that zhuzh, yes, you can get implants, and you can definitely do it at a second stage. And interestingly, and this is something that we'll be discussing a lot at the Breast Masters Symposium, which is a conference in a few months' time, a lot of surgeons actually do breast lifts with implants in 2 stages. So the logic is that a breast lift with implant amongst all plastic surgeons, international, local here in Australia, probably has a revision rate of about 15 to 20%. So in 15 to 20% of patients who have a breast lift with implants, we need to do further surgery to get it just right. So there is quite a bunch of plastic surgeons who think, well, that's too high a figure. So why don't we just split it up into 2 operations anyway, and do the breast reduction or the breast lift in one operation, allow the patient to heal, and then come back and put in implants in a separate operation about 3 to 6 months later. And in doing that, you hopefully reduce the risk of revisions. But in my mind, that's a 100% revision rate because you've definitely split it up into 2 operations. Anyway, it's something that we can talk about. And as I keep saying, everyone is different. And what I would recommend to you, Jody, might be very different to what I recommend to your identical twin. Okay, so, gosh, this talking is tiring business. But let's keep going because that's what we do. So I've had some patients say that brachioplasty can be painful. Is it true? And also, where is the best place to have the scars? Brachioplasty is the operation that I see the greatest degree of spectrum in patients' recovery. So I will see patients who will have a flawless tummy tuck recovery with no pain whatsoever, then truly suffer with their arms. And the reciprocal. Someone who just has no pain from their arms and had a really tough time with their tummy. And I can't tell you why. I think that arms in general, it makes sense to me, would be a bit more sore because there are so many nerves traveling down into your arm to reach your hand. So nerves are what make us feel pain. And if they're getting swollen and tight and feeling a lot of pressure, then they're really going to unfortunately release this horrible burning feeling for a few weeks until the swelling dies down. So I would say to people, please, sort of bank on 2 to 3 weeks, 3 weeks off at least with your arms, just because they can just be quite achy and quite burny. And the one thing that I have found really helps to improve brachioplasty recovery is compression to reduce the swelling, because then that hopefully means that the swelling in the nerves is also not as bad and they won't be as burny feeling. And perhaps even a lymphatic massage. And for my patients, what I've started to introduce is a lymphatic massage at about the 2 to 3 week mark with the physio who is located in our building. Where is the best place to have scars? Oh, good question. So the best place for a brachioplasty scar, in my opinion, is where most people won't see it, which I think is in the junction between the front of the arm and the back. So with your arms by your side, they might just peek out when you're looking at the person from behind. The problem with arms is that they're cylinders, and interestingly, they rotate. So when you're talking to people, there will be some point when you can see that scar. And look, it's the price we have to pay for a better contour, unfortunately, because you will notice in the future that people's attention will always be slightly caught by the presence of that scar on the arm. So I think the ideal brachioplasty person is someone who says that their clothing doesn't fit them properly, because their arm excess is so significant, because I think in the worst case scenario, if they do get really, really awful scars, then at least they're maybe still camouflaging them in their clothing, but at least their clothing is still fitting them better. So Michelle's written, I love my compression for my arms. I felt awful when it was off. And again, this is a really variable thing. I think it makes sense that people would feel more comfortable in their compression because it's reducing their swelling and it's supporting their wound and it's supporting their movement, and it's also avoiding chafing between your scar and the rest of your body. But there are some people who find the compression very tight and almost compounds the tightness of their scar and their wound. So listen to your body. If it feels good, it probably is good. If it doesn't feel good, speak to your surgeon or speak to me and try to do something else instead. Jules, I'm really happy to hear that. I had wondered about that. So Jules has written, Dermablend covers arm scars perfectly. And hopefully I will see her soon and I can see how good the Dermablend is. Okay, so I'll catch my breath and then we'll answer the next question. By the way, if it sounds like I'm shaking or breathless, it is because you are making me nervous, but no, much more importantly, it's freezing in this room that I'm in at the moment. Here we go. How long, oh, hang on. Oh no, I've answered all of the questions. That's fantastic. Okay, so let me think of something else to talk to you about. Silicone breast implants. So let me tell you about the longevity of implants, because this is something that a lot of people are often surprised by. So a lot of people think that when they get a breast implant, it's going to last forever. Or if they know it's not going to last forever, they come with this figure of 10 years. I don't know where that 10-year figure came from. I think it's because plastic surgery long-term studies usually focus on the 10-year mark. So our 10-year statistics on breast implants are actually that 25%, so 1 in 4 women, will need further surgery if they have breast implants within 10 years. So 25% within 10 years will have further surgery. But the other way of thinking about that is that 75% don't, and just keep going because there's nothing wrong. So why fix what's not broken? How do you know if there's something wrong with your implants? So the two main things we worry about are capsular contracture, which is hardening of the implants. So the body builds a layer of scar tissue around the implant which squeezes it and tightens it and makes it hard. And the other complication we worry about is rupture. And if you come to my office, I'll throw an implant against the wall so that you can see just how tough they are. They are really, really tough. But still, we can have accidents, we can fall, we can be hit in the chest really firmly, and it is possible for the implant to rupture. So if your implant isn't hard and you have no history of trauma to suggest that your implant may have popped and everything's looking good, you don't need to do anything about it. I probably would still suggest that after about the 5-year mark, it's a good idea to maybe see your plastic surgeon or see your GP and just have a checkup and make sure your implants are okay. So I would probably suggest screening to check that the implants are okay from 5 years onwards. And also maybe having a little quiet, shh, don't tell anyone else, fund of money in a bank account somewhere that can pay for any operation that you might need in the future to replace those implants. So this is another item number that might be changing soon, that at the moment we are covered to remove and replace implants if there are any complications of those implants, but possibly by the end of the year we are not. So we'll be able to remove implants that have a problem, but we won't be able to put new ones in with the implant price covered by Medicare or your health insurance company. So keep that in mind, be sensible, be logical. If it's not broke, don't fix it. But also understand that no device lasts forever and breast implants are no different. Okay, anyone else got any questions? Trish, can you think of anything you wanted to ask me? Trish knows it all actually. So because she hears from all of you guys and knows exactly what everyone's going through. And I think it's a wonderful thing about talking to each other and gathering knowledge from each other's experiences. With so much sharing and the benefit of social media and Facebook and all the information you can get on the internet, always be really careful about what you're reading, because what is the perfect answer for one patient may not necessarily be the answer for someone else. So listen and learn, but also take it on board with logic that it may not apply to you. Okay, so Jules has asked me about Botox or fat transfer, which are very different things. So botulinum toxin, and the brand name is Botox. Botulinum toxin is a injection which relaxes the muscles. And so if the muscle, for example, behind your crow's feet is relaxed, then you can't squeeze as tight and the crow's feet won't be as deep. Botox is great. I love it. I'm addicted to it, but it has to be topped up every 3 months. What does fat transfer do? So fat transfer is used in the face as natural filler because it's your own fat and we suck it out from your tummy or from somewhere else, and in small volumes injected into the face, like much in the same way that we would use filler. So for example, cheek augmentation, or the nasolabial folds, or the marionette lines. So it's usually used to a different area to how we would use Botox, and it's to replace volume or to camouflage. Excuse me, so to put volume in one area so that it's filling up the skin and perhaps pulling up. You can see that. Oh God, that's awful, isn't it? You can put fat into your cheekbone and then lift up the nasolabial fold in that way. Wound breakdown, why does it happen? So we have this joke amongst plastic surgeons that the only surgeons that are allowed to put a wound under tension is a plastic surgeon. Because the goal is, as I said to you, do not close a wound under tension. Put 3 layers of sutures in so that wound is not under any tension and it's going to stay put. We hate tension. Tension on the skin strangulates the skin, so the blood supply gets cut off if skin is pulled too tight. Strangulates the skin, and if it's not supplied by oxygen and it's not breathing and it's not got a good perfusion, the wound will then not heal and it will fall apart. So if the blood supply to the skin is good, we will avoid a wound falling apart, but much more importantly, it won't get infected as well. So wounds fall apart when they're pulled too tight or when they get infected. And I think that is the real art of being a plastic surgeon, that you know how tightly you can pull and you respect the blood supply of that skin and you know what it's capable of doing. In massive weight loss patients, we're a little bit more at risk because I think there's a lot of pressure to make our patients as tight as possible. And then the risk is then that wounds fall apart. It's the oddest thing. For example, I will often look at a thigh lift patient, for example, and I'll know that I will have pulled a wound really firmly and it will just separate a little bit, and yet the patient, I will look at it and say, it doesn't even look that tight, why has it fallen apart? And often it's at the T-junction, the point where 3 parts of the wound are meeting. So in that situation, it's not necessarily just falling apart because it's tight, it's falling apart because the blood supply is compromised, because it's coming across 3 different zones rather than a big sheet of skin. Bit hard to explain, but there are certain areas that are at risk, and there are certain tricks that we can then do to avoid them because we know that they are at risk, if that makes sense. Okay, sorry, I'm going to have to backtrack a bit. Got any tips on healing to reduce numbness? Okay, so there are certain wounds that are predisposed to numbness, and they tend to be wounds where the skin is lifted off a lot and then laid back down. So for example, in a facelift, all the skin from there out to there is lifted up and then laid back down. So that skin is being detached from its nerve supply, and so it's going to be numb by the end of the operation, and then the nerves have to grow back in. Similar to a tummy tuck, lifted all the way up, laid back down, so it's detached from its nerve supply, it's going to go numb, and then it has to grow back in. So the only way to reduce numbness then would be not to lift up the skin too much, which we don't want because we want it to be as firm and tight as possible. We don't want to do that. Compression again to help the nerves recover. So nerves go numb and don't fire and work as well if they are also swollen. So the nerves supplying the skin also swell up after surgery. If you remove that swelling, then they'll start to fire and work properly. And then unfortunately, you just have to be patient. So what I usually say to my patients is, just like you can see your scar on the outside is evolving and changing, there's a lot of evolution and healing that's happening on the inside too. And you've just got to hang in there and let it pass and let your body heal. I would say any numbness that a patient has at about the 12 to 18 month mark is probably going to be there forever. But I do tell a funny story to a lot of my patients about how I've had 2 cesareans, and I was chatting to a patient about, the numbness is going to be permanent on the scar, and I was tapping my cesarean wound and going, see, I'm numb here, and then lo and behold, as I was tapping, I realised I could feel myself tapping. So the numbness across my cesarean scar stayed numb for 4 years, and then suddenly came back. So never lose hope. Is Botox to be feared because we don't know what it's going to do to us in the future? Julie, I think that's a really insightful and interesting question, because we don't know. We don't have that crystal ball to take us into 2050. And I think it's important to have a healthy degree of skepticism about any medication that we have on the market. If I was to try and predict what we should worry about with Botox, I think it would be, what effect is it having if you chronically use it? Are the muscles eventually going to weaken to such a point that they do fail to work? And I don't even know if that's a valid concern because, look, I've personally have been using it for about 6 years now. And I know that there are people out there in the community that have probably been using it for 10 to 15 years, and they're all fine. So I think so long as you're using it judiciously, you've got a good person recommending it to you who doesn't look weird themselves, then it's quite safe. And I guess we just have to see. So I'll let you know when I stop using it myself. But at this stage, I think it's quite safe. And the good thing is actually Botox has been used for medical purposes since the 1970s. And you may be very surprised to realise that the most common group that consume Botox are actually children. So the way we use botulinum toxin is that in kids with cerebral palsy, for example, who have a really bad contracture of their arm, that are just born with that flex contracture, we inject their biceps muscle, or we inject one of the muscles to get them to open up their arm so that their parents can actually clean them. And the doses that we use in kids is about 10 to 100 times greater than what we use for cosmetic purposes in the face, because facial muscles are so much smaller than those big muscles, so they don't need as big a dose. Bet Cole has asked, do you require referral for a consult or just when you book a referral? I go to a practice where most leave after 6 months, so I haven't had a regular GP for some time. Okay. Look, I think the main goal is, if possible, to get a GP or to get at least the letter that comes from a practice that you've been to regularly, because often, you're right, even though doctors come and move and that's a really painful thing, the history is usually within their computer system, so it will come on your letter. And I think it's also a good idea to be able to bounce back to that GP if you need to. For example, maybe get a post-operative blood test and they can request it for you, or fill out another pain relief script. So if there's someone who knows you're about to undergo surgery, and then you go back to them, then that's a really good idea, because then they're more on board. They understand what you're going through and they know that what's been happening to you for the past few months. Not everyone needs a referral. I know I talked about referrals before and I said it's a really good idea to have one. So if you are having a cosmetic procedure such as breast augmentation, liposuction, lower lid blepharoplasty, facelift, all of those things don't have item numbers, so you don't necessarily need a referral from a Medicare rebate point of view, but I still like you to have it, because I still like for your GP to know what's going on. If you come from the point of view of worrying that your GP's going to make you feel bad for having plastic surgery, or you just don't want your GP to know, then that's perfectly fine, and I completely appreciate your need for confidentiality, and I won't communicate with them. Okay, Jody writes, after liposuction, is it the same time frame for wearing compression garments as surgical incisions? Is there any products you recommend using after lipo to ensure there's a smooth result on the skin? Really good questions, Jody. I usually find that my liposuction patients also only want to wear the compression for about 3 weeks, and they're the ones that are keener to get out of it than the incision people. And I think it's probably because they don't have that big wound, and I think maybe the big wound is what makes people feel like they need something holding them. There's that sort of that weird sense of, am I going to fall apart if I'm not in my compression? So just 3 weeks again for liposuction. If you continue to wear it thereafter, I think you probably do find that there are less fluctuations through the day in your swelling, and you may just feel a little bit more even. Again, listen to your body. If you're feeling like you need that compression to help support you and help your skin retract and help reduce your edema, that's absolutely fine. The interesting thing about compression is that I think it helps you psychologically adjust to your surgery a little bit more as well, because you're not looking at yourself so much. There's a layer of camouflage. So that's kind of secret plastic surgeon's business. Don't tell anyone I said that. But just like we put paper tape on people's noses after rhinoplasty, compression can just help you adjust to your new appearance when you're having liposuction. Makes you not look at the bruising, makes you not look at the skin irregularity, lets your body heal without you getting anxious about how you're looking. In terms of the irregularity of the skin, that's a really good one. I don't know if there are any products that help to do that. Again, what I've sometimes suggested to patients is having some massage to help move the fluid through, and in the hope that maybe it's fluid and swelling that's causing the bubbles and the irregularity. The concern is that with liposuction, you can't do it completely evenly. It's really impossible. So you're really just hoping that under the skin you are moving that rod nice and smoothly to gently remove the fat. But if you go into one area and double dip, then that area can make a little divot. And depending on how thin your skin is, that divot will look less obvious if you have thick skin, or more obvious if you have very thin skin. So the way I try and avoid those irregularities in the skin is to use a finer rod, or a finer cannula is what we call them, to suck out the fat, in the hope that if I am double dipping, at least it's with a very, very thin rod rather than a big thick one, because if you double dip with a thick rod, then obviously it's going to create a bigger blob or a bigger divot. There are some surgeons as well that would do a few sort of gentle skin tightening treatments after liposuction to help smooth it out. I'm not too sure if there's any evidence that that does improve things, but perhaps that's something to look at. So something like radio frequency or ultrasound, so thermage, those topical things that they rub on your skin to help it tighten from the outside. That's what I'm talking about. Okay, so we've got Lorraine. I've lost weight, but still bumpy on the tummy. Could it be cellulite? Is the only way to deal with it an extended tummy tuck? I think that's what ETT means. I've lost weight, but still bumpy on the tummy. Could it be cellulite? Lorraine, I'm not too sure what you mean. Do you mean that you've had a tummy tuck and it's still a bit bumpy after the tummy tuck? You can get cellulite of your tummy, or it can be a bit like what we were just talking about, that if you've had some liposuction during your tummy tuck, that can leave a few bumps and irregularities of the skin. What an extended tummy tuck does is it tightens the tummy skin, but then it also tightens the loose skin that we carry around our hip area, because the incision curves around the side just that little bit, to bring up the outer thigh and also to bring down the loose skin of the hip area. So that's going to help any cellulite you also have in the upper thigh area. Tony says, I read something about fat transfer to fix breasts instead of implants. Tony, I'm so excited that you brought this up. Okay, so in our conference that we were just at on the weekend, so a lot of you would know that I'm on the board for the Australasian Society of Aesthetic Plastic Surgeons, and we have an annual meeting every year. And the big topic this year, Tony, was breast fat transfer, for two reasons. The first is that it's finally legal in Australia. So what I mean by that is that our insurance companies, our medical indemnity companies, are finally happy to indemnify us to do fat transfer to patients. And the other important reason is that we've got really good evidence to show that it's safe. So the main reason why I have been avoiding fat transfer so far in women's breasts is that we know fat has a lot of stem cells, and we know that stem cells are cells that can turn into any cell in the body, including a cancer. So we did not want to do something to women that potentially might cause breast cancers in the future. The additional concern is that if that fat dies in the breast, it gets calcified, and the way we normally pick up breast cancers is by looking for calcifications in cancers in women's breasts. So we now know that we can safely do the fat transfer to breast, doesn't increase your risk of breast cancer, doesn't lead to confusion with picking up breast cancers on mammography. Having said that, you cannot really use fat grafting the way we use implants currently in Sydney. So most of my patients look to have a breast implant that's anywhere between 300 and 800 cc in size. The ideal fat transfer volume is about 200 cc's. So trying to get more than that into a woman's breast probably won't work. It'll probably just turn into oil or sludge or calcium and won't look good and won't feel good. So in my mind, what's the role then for fat transfer in a breast? It probably has two roles. If you already have breast implants, but you're thinking of eventually getting rid of them, then we do something called hybrid breast implant or fat grafting, where we eventually downsize the size of the implant and fat graft. So after multiple operations, we've eventually got rid of the breast implant and left you with a natural fatty breast. So does that make sense? Multiple procedures, eventually putting in a smaller and smaller and smaller implant, bigger and bigger and bigger amount of fat graft. Fat grafting for me is a tool. It enhances someone's result. So if someone has breast implants and they're really, really, really skinny, and we just want to soften the edge of the implant, make the implant less palpable, less visible, we can just fat graft a little bit on top of it. Stay tuned, Tony. Great question. I can't wait to see what we're doing with fat grafting in a few years' time. Trish, can you recommend a doctor in Sydney who does Botox for headaches and neck muscles? And covered by Medicare. Okay. So, I do. It depends what you're looking to have it done for. So obviously if it's covered by Medicare, then it's being done for migraines, I assume, is the question. And usually what we recommend is goes according to the location of the headaches. So the way botulinum toxin was initially used to help with wrinkles in the face is that it was an incidental discovery by a neurologist. So the neurologist was injecting his patient's forehead because she had migraines, and it was there to help the migraines. And he rings her up a few days later and he goes, "How are your migraines going?" And she goes, "Oh, Doc, yeah, no, the migraines are great, but I look fantastic." So that's my American impersonation, guys. And so it was an incidental discovery that this woman looks so much better after she'd had her migraines treated with botulinum toxin because her wrinkles disappeared. So you can use a Medicare item number for Botox for those purposes. And what we have to show is that you've tried everything else for your migraines and nothing else works, and you've had to use botulinum toxin instead. But I usually do it in conjunction with a neurologist to make sure that we've got the right program and that the patient properly satisfies those criteria. Cool. Oh, thank you guys. I needed a bit of a break, too much talking. So does anyone else have any other questions? Let's see, what's the time? It's 8:02 p.m. No, that can't be right. My computer's frozen. That's really funny. I can't even tell the time on my computer. That's what a terrible computer person I am. Has anyone else got any other questions? Cool. Okay. Well, let me think. Can I think of any other more questions to answer? What are the other common things that people ask me? Timing between operations. So that's a very common question. So a lot of massive weight loss patients need multiple operations in order to completely bring their skin back into line. So just to quickly go through that all, what I would usually recommend is you've got to allow your body to heal. You've got to allow your family to heal. You've got to get back to them and make sure they go back to normal so they don't hate you because all you keep doing is having surgery on them and disappearing. And you've got to build up your hemoglobin again so that we can get you back into the theatre and possibly lose a little bit more blood again. So I usually recommend 6 to 12 weeks. It's dependent upon the patient, on how well you recover and how quickly you bounce back. If you feel strong again, you're not needing a nana nap at 2 p.m. anymore because you've recovered. If your hemoglobin is good, if your scarring is good, then go for it. Go for your next stage. Okay, guys. Well, Trish tells me it's 9:10 p.m. And I'm a good girl, which means I have to go to bed nice and early so that I can be fresh for my patients tomorrow. And I hope you guys all get a little bit of TV time and chillax time with your families tonight. Thank you so much for joining me. I am so flattered, and I hope to see you all soon. Bye.